Whether you're getting close to Medicare eligibility or trying to simply learn about your Medicare options ahead of time, you likely know it can be very easy to feel overwhelmed by the numerous Medicare choices that you have while trying to time everything correctly to avoid mistakes that can impact you for years to come. Luckily, in today's video, we will give you the 4 keys to make sure you enjoy a stress-free transition to Medicare. First, my name is Cameron Giardini, and together with my family, we operate our independent Medicare-focused insurance agency called Giardini Medicare, where we specialize in helping people with their transition to Medicare. And we want to share with you what we have learned while helping thousands of our clients with their transition to Medicare over the past several years. So key number 1 is understanding your Medicare options early and deciding if you even need Medicare in the first place. There is a very important question that you should ask yourself that might just change your entire approach to Medicare as you turn 65. And that question is, do I even need Medicare? Now, in the nonstop sea of postcards, nonstop phone calls, and advertisements bombarding you as you approach Medicare eligibility,
It's me again.
it is very easy to assume that enrolling in Medicare is mandatory for everyone at age 65, when in reality, it is not always so cut and dry. We will have another video devoted to this topic in more detail, but let's briefly discuss why you may or may not need Medicare as you approach age 65. Although it is possible to be eligible for Medicare before age 65 due to receiving Social Security disability or due to other factors, for the majority of you watching this video, age 65 is when you will first be eligible for Medicare. This is when you will have what is called your initial enrollment period, also known as your IEP. This is a 7-month window allowing you to enroll in both Part A and Part B of Medicare, and it consists of the 3 months before the month you turn 65, includes the month you turn 65, and includes the 3 months following the month you turn 65. Now, just as a quick reminder, your IEP, it does begin 1 month early if you were born on the first day of the month. Now, although this initial enrollment period will likely be the first opportunity you have to enroll in Medicare, it is crucial to understand that your current health insurance and your current situation plays a significant role in determining whether Medicare is a must-have or simply just an option for you at this stage in life. So first, if you are approaching age 65 and you are covered by some of the following health insurance options, you will likely need to enroll in both Part A and Part B of Medicare when you're first eligible to do so during your IEP. Now, this list, of course, is not all-inclusive, but these coverages can include things like individual health insurance plans, which could be either through the ACA and Marketplace or non-Marketplace plans. It also includes Christian or non-religious health share plans, retiree coverage from a former employer or union, COBRA coverage, as well as active employer coverage from a small employer with less than 20 employees. And of course, this especially applies if you currently have no health insurance as you approach age 65. So that sure seems like a lot of reasons to enroll in Medicare at age 65, but there is a common reason that many people choose to delay Medicare enrollment past age 65, and that is due to having active group employer health coverage through your current employment or a spouse's current employment, and importantly, that employer that is providing the coverage has over 20 employees. Now, in this case, your employer-provided health insurance, it can remain your primary coverage even when you become eligible for Medicare at age 65. This lets you delay Medicare enrollment without facing lifetime penalties or medical claims issues from not having the proper primary coverage, like if you had a small employer plan. This also gives you access to a special enrollment period to enroll in Medicare Part B in the future after you no longer have access to that initial enrollment period that we talked about. But why would you want to delay Medicare if you're eligible for it? Well, it simply comes down to the fact that contrary to what many people think, Medicare, it is not free, or at least not Part B of Medicare. Most people will pay no monthly premium for Part A of Medicare due to yours or a spouse's work history while paying Medicare taxes through payroll taxes, but Medicare Part B comes with a base monthly premium in 2024 of $174.70 cents per month, and this can be even higher based on your income, as you can see from the chart on the screen. So if you have good employer-provided health insurance that makes more financial sense than enrolling in Medicare, or you are covering your spouse or dependents with employer health insurance, you may follow the path of many people that work past age 65 and delay at least Part B of Medicare and possibly even Part A, which may be due to a reason we will discuss in key number 4 in this video. Now, just because you might not need Medicare at age 65, it does not mean that you can't enroll in it. If you would prefer Medicare coverage instead of your current employer-provided health insurance, it is for this reason that no matter what your situation is, we generally recommend that before you start planning that 65th birthday party, make sure to connect with an independent insurance broker or another independent source of Medicare information about 12 months before your Medicare eligibility, and just make a quick game plan for if and when you will need Medicare coverage. Medicare is certainly not a one-size-fits-all journey, and the path you choose should reflect your personal healthcare needs, your current coverage, as well as your financial situation and your coverage preferences. Real quick, don't forget that in addition to this video, another key to a stress-free transition to Medicare is signing up for our free online course at gmedcourse.com. This is where you can find the answers to just about any Medicare question you may have, but with that out of the way, let's move to key number 2 for this video. And diving into our second key for this stress-free transition, we will help you better understand the often confusing alphabet soup of Medicare coverage. First, like we briefly discussed earlier, you have Original Medicare, which provides the foundation of your Medicare coverage. Original Medicare can also be Traditional Medicare, but it is divided into 2 parts. The first part is Part A, which provides hospital insurance and covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care services. Now, Part B, on the other hand, provides medical insurance and covers most doctor services, outpatient care, medical services, and preventive services. Now, contrary to what you may think, although Original Medicare provides coverage for these services, it does not mean it provides full coverage. In fact, here you can see on the screen some of the out-of-pocket medical costs you would be responsible for if you only have Original Medicare Part A and Part B with nothing else. But of course, for that reason, the Medicare landscape, it does not end with Original Medicare. So for individuals that want to keep Original Medicare as their primary coverage, you can enroll in a Medicare supplement plan, which is also known as Medigap coverage. These plans, they are sold by private insurance companies, and like the name suggests, they provide secondary coverage to Original Medicare to help cover some or all of the financial gaps left by Original Medicare, like the ones that we showed in that chart. Now, of course, with all things Medicare related, Medigap plans, they also have their own alphabet soup of plan options. This is because Medigap plans, they have standard basic medical coverage, which is determined by their plan letters, which range from A to N. Now, here on the screen, you can see the different Medigap plan letters that are available for most consumers, as well as the coverage they provide. Although this can seem overwhelming, many of these Medigap plan letters, they simply won't make financial sense based on the coverage they provide compared to what they actually cost for monthly premiums. So to keep things simple, we almost always recommend that you focus on either Plan N or Plan G, or just both of them, if you decide you want Medigap coverage. You can also consider possible high deductible Medigap options as well. Now, we could of course get into details about Plan N versus Plan G right now, but instead we encourage you to watch this video that we made doing a deep dive into Plan N versus Plan G, and watch that after you finish this video. Now, Original Medicare, even with a Medigap plan, it will not provide coverage for most of the routine prescriptions you get filled at retail pharmacies. So this brings us to the next noodle in the alphabet soup of Medicare, which is Part D. This can be easy to remember if you just think of D for drugs. Part D plans, they are sold by private insurance companies that contract with Medicare, and these plans, they provide coverage for many prescription drugs you would receive at the pharmacy that would not be covered by Original Medicare or by your Medigap coverage. And moving on, our final letter associated with Medicare is Part C. So it may be easy to fall for the trap of thinking that Part C is another part of Original Medicare, but in reality, it simply refers to Medicare Advantage plans. Now, these plans, they are offered by private insurance companies that contract with Medicare and receive funding directly from the federal government to provide you an all-in-one private alternative to original Medicare coverage. This is not the same as staying enrolled in original Medicare. And instead, Medicare Advantage plans, they are often marketed and referred to as Part C because they bundle the coverage and benefits of Part A, Part B, and usually Part D all into one plan. Many of these plans, they also provide extra benefits not covered by original Medicare, but they come with their own set of rules that we will shortly discuss. We know trying to sort through all of these coverage details, it can seem overwhelming, so here on the screen is a brief overview of the two main coverage choices you have when it comes to Medicare. This essentially comes down to Medicare Advantage versus original Medicare with a Medigap and Part D plan to go with original Medicare. Now that you are more aware of the different parts of Medicare, as well as an overview of the differences between Medicare Advantage and Medigap coverage, this brings us to key number 3 of a stress-free transition to Medicare. Now, key number 3 is, of course, choosing between which of the two options we talked about between Medicare Advantage and Medigap coverage that you actually want to enroll in. This will almost certainly be one of the most significant decisions you will make during your Medicare journey, and it will shape your healthcare experience while on Medicare for many years to come. First, just like with any type of insurance that you buy, you can't decide whether or not Medicare Advantage plans or Medigap plans are right for you without knowing how the monthly costs are different for the two coverage options. Regardless of which option you choose, you will still have to enroll in both Part A and Part B of original Medicare, and you will be responsible for paying the monthly premiums for that coverage. Now, as we mentioned earlier, Part A of Medicare is typically premium free or $0 per month for at least 99% of Medicare beneficiaries, and Part B comes with a base monthly premium that does change from year to year, but currently it is $174.70 per month as of recording this in 2024. Generally speaking, if you choose to enroll in a Medicare Advantage plan as an alternative to original Medicare coverage, it will come with no additional monthly premium on top of what you're paying for Part B of Medicare. We can say this because according to the Kaiser Family Foundation, in 2024, 66% of Medicare Advantage plans are offered with 0 per month monthly premiums, which also includes prescription drug coverage typically. In fact, they also report that 19% of Medicare Advantage plans offer some type of reduction to the Part B premium during 2024. However, overall, Medicare still reports that the average Medicare Advantage premium in 2024 is $18.50 per month. Medigap plans, on the other hand, they typically come with higher monthly premiums compared to Medicare Advantage plans. Here are two maps that can show you some of the average monthly premiums you might expect to pay for a Medigap Plan G and Plan N across the country for a 65-year-old male non-tobacco user. As you can tell, your Medigap pricing, it is going to vary greatly based on where you live, and the prices will also vary based on your gender and other factors. We can't just stop with the Medigap premiums though, since like we already mentioned, if you do enroll in Medigap coverage, you will almost certainly want to enroll in Part D prescription drug coverage as well. So in 2024, Medicare reports that the average Part D monthly premium is $55.50 per month, but Part D monthly premiums, they can vary greatly from one plan to another, with KFF reporting that the national Part D plan premiums, they can range from $0 per month all the way to $108 per month, and it can be higher than that locally in some places. Here on the screen, you can see the general differences in monthly premiums for a 65-year-old in our home state of Michigan enrolling in a Medicare Advantage plan versus Medigap and Part D coverage. But why would people choose to enroll in Medigap and Part D coverage if it often comes with higher monthly premiums compared to Medicare Advantage plans? Well, you may have already guessed it, but what you pay in monthly premiums is just a small piece of the puzzle, of course, when it comes to your Medicare coverage. You also have to consider the out-of-pocket costs and the coverage differences when comparing Medicare Advantage and Medigap and Part D coverage. There are far too many coverage differences to discuss in just this video, but here is an overview of some of the key differences between the two. Because Medicare Advantage plans are managed alternatives to original Medicare, they typically come in the form of HMOs or PPOs with specific networks of providers and facilities, and they may require prior authorization from your providers before before you can have certain procedures or treatments done. Medigap plans, on the other hand, follow original Medicare when it comes to flexibility and coverage. Medigap plans, they are not HMOs or PPOs, and instead they allow you to see providers nationwide that accept original Medicare. Because Medicare is still your primary coverage, prior authorization is also extremely rare with Medigap plans. And the insurance company has virtually no say for what you can or cannot have done. In general, Medigap plans, they provide lower out-of-pocket cost potentials compared to Medicare Advantage plans. Plan G is currently the most popular Medigap plan available, and it only leaves you responsible for the Part B deductible, which is $240 for the calendar year of 2024. And then after you meet this deductible, Medigap Plan G pays for all Medicare covered services for the remainder of the year. While Medicare Advantage plans, on the other hand, they have a maximum out-of-pocket limit that can be up to $8,850 for in-network services for 2024. Although we won't use that number as a scare tactic, because according to the actuarial and consulting firm known as Milliman, they reported that the average Medicare Advantage max out-of-pocket is $4,750 in 2024, which is of course much lower than that actual $8,850 upper limit. And last but not least, Medicare Advantage plans, they are now famous for the extra benefits they provide, which includes coverage for many services not covered by original Medicare, whereas Medigap plans, although not always the case, they will typically only cover the same services covered by original Medicare Part A and Part B. Now, like with anything in life, choosing between Medicare Advantage and Medigap coverage, it comes to weighing the pros and cons of each one to understand which one you are personally comfortable with. Here, you can see a chart of some of the common pros and cons we think of when it comes to Medicare Advantage coverage. Generally speaking, this comes down to being willing to deal with the higher potential out-of-pocket medical costs, as well as the possible provider network restrictions and prior authorization that comes with a managed care system like Medicare Advantage. This, of course, is in exchange for low or no monthly premiums, in addition to what you pay for Part B, as well as many extra benefits that are not covered by Medicare. Here, you have the overall pros and cons for having original Medicare and Medigap coverage on the other side. These are essentially the opposites of the pros and cons we just showed with Medicare Advantage, since this comes down to being okay with paying higher monthly premiums for Medigap coverage, and keep in mind these premiums will increase over time, and additionally you will likely have to pay a separate monthly premium for Part D prescription coverage, all of this while missing out on many of the extra benefits often provided and touted by Medicare Advantage plans. Now, these higher monthly premiums, of course, being in exchange for that stronger medical coverage with the lower potential of out-of-pocket costs, as well as the freedom and flexibility to see providers nationwide that accept original Medicare with much less worry about prior authorization. Overall, the decision between Medicare Advantage or Medigap coverage, it would be pretty simple if you were able to change from one to the other without restrictions. Then you could simply get Medicare Advantage while you're healthy and change to Medigap coverage when you do need more coverage based on your health changes. But of course, in most states and in the vast majority of situations, this is not possible, since after your 6-month Medigap open enrollment period is over, and outside of guaranteed issue situations, if you want to change coverage from a Medicare Advantage plan to a Medigap plan, you will have to do so by answering health questions and going through medical underwriting. At that point, your acceptance into the Medigap plan, it is not guaranteed, and you can be approved or denied coverage based on your pre-existing conditions and your health at the time of the application. Ultimately, deciding between Medicare Advantage and Medigap coverage, it will be easier with the help of a good independent broker that can provide you with the specific quotes for each side of the coin, so you can consider which might be right for you based on your unique healthcare needs, lifestyle, and budget. If you need to connect with us or another broker that we trust, you can use the link in the description below this video, and don't forget to please watch the video we made breaking down Medicare Advantage versus Medigap coverage all in under 10 minutes. Now, last but not least, nothing is more stressful than unexpected situations when you begin Medicare. And this brings us to our final key in this video, which is to make sure that you are aware of often overlooked or misunderstood Medicare situations that you may face when turning 65 or beginning Medicare for the first time. Let's start with the income-related monthly adjustment amount, also called IRMA. In reality, this is just insurance jargon for saying if you earn more money, you might pay more for your Medicare premium. Here are a few things you should know about IRMA. First, this surcharge, it only applies to Part B and Part D premiums, which it does include Medicare Advantage plans with prescription drug coverage, so don't think you can avoid IRMA by getting a Medicare Advantage plan. You can see here on the screen the two charts that show what you may pay for Part B and Part D coverage based on various income levels and whether or not you file joint or single taxes. Next, you should know that IRMA is calculated by the Social Security Administration using your income from the taxes you filed 2 years in the past. So for example, right now in 2024, they would actually be using your modified adjusted gross income from 2022 to determine your possible IRMA surcharges. As an added tip, you should be able to calculate your modified adjusted gross income by adding together lines 2A and line 11 from your 2022 IRS Form 1040. But all of this brings us to the most important thing you should know about IRMA, which is that if you experience a life-changing event causing your income to lower, you can use a form called the SSA Form 44, which we will link to below in order to request an IRMA redetermination to hopefully get your surcharge reduced or even fully removed based on your new lower income. We do have a podcast episode discussing this in more detail, but essentially this means you don't have to wait 2 years for your lower income to be noticed by Social Security and then reflected in any possible IRMA surcharge reductions. An extremely common example of this is when you retire and now your current income is much lower than the income from 2 years ago that Social Security is using to calculate your IRMA surcharge. Now, another misunderstood Medicare situation is becoming eligible for Medicare while being covered by COBRA coverage. Although COBRA coverage is a continuation of your former employer insurance and the coverage feels just like what you had while you were working, it does not function the same as employer coverage when it comes to Medicare coordination and enrollment rules. In reality, once you're eligible for Medicare, COBRA coverage, it typically becomes secondary coverage regardless of the size of the employer that provides it. This means that not properly enrolling in both Part A and Part B as your primary coverage can cause claims denials and large out-of-pocket costs. Also, if you have COBRA coverage and then you become eligible for Medicare, just know this may cause your COBRA coverage to terminate. So if you're approaching age 65 with COBRA coverage, make sure to reach out to somebody to understand your options. Now, earlier in the video, we did mention that there might actually be a reason to delay Part A of Medicare, even though it comes with no monthly premium typically. And this brings us to the topic of health savings accounts, which are also known as HSAs. So once you're enrolled in any part of Medicare, Part A and or Part B, you are no longer eligible to contribute to a health savings account, which is why you may want to delay Part A to continue those contributions. Of course, there are many nuances when it comes to HSAs and Medicare, so please make sure to watch this video if you want to continue contributing to an HSA past age 65 and you need to learn about your options. Last but not least, unlike with IRMA, if you instead find yourself struggling to afford the base Medicare Part B premiums, or if you struggle with rising prescription costs, make sure you don't overlook the possible financial assistance programs that might be available to you. The first program to be aware of is the Medicare Savings Program, which it may allow your state's Medicaid program to pay your Medicare premiums or out-of-pocket costs. Now, your eligibility for these programs, it will depend on your income and resources, so we will link to that information in the description below. Even if you don't qualify for Medicare savings programs, you may still be able to qualify for the low income subsidy program for prescription medications. This program, it is also called Extra Help, and it is a federal program from Social Security that can help with Medicare prescription cost. You can see the income and resource guidelines for this program here, and we will also link to it below. And just know that the application for this program, it can be quickly completed online through the Social Security website. website. At the end of the day, making your transition to Medicare can be both daunting and exciting. However, one thing we know for sure is that understanding your options and being prepared ahead of time can greatly impact the experience you have. We know with the information we have talked about in this video that you are one step closer to making a successful and stress-free transition to Medicare.